Butter, often misunderstood due to its high calorie and saturated fat content, can actually be part of a healthy diet when consumed in moderation. It's rich in essential nutrients, including fat-soluble vitamins like vitamin A, D, E, and K2. Just 1 tablespoon of butter provides 11% of your daily vitamin A needs. Vitamin K2, also known as menaquinone, is vital for heart and bone health. Butter is not just a source of vitamins. It contains over 400 types of fatty acids, predominantly saturated fats, but also beneficial monounsaturated fats like linoleic acid. The presence of butyrate, a type of fat in butter, is known to aid in weight management, improve digestion, and reduce inflammation. Moreover, butter is a good source of antioxidants, including carotene, which supports cell growth and repair while reducing the risk of viral infections. Butter is a common ingredient in many dishes, known for its rich flavor and creamy texture. It contains a variety of nutrients that can contribute to your daily nutritional intake. In 100 grams of unsalted butter, you'll find 17.94 milliliters of water, while salted butter contains slightly less at 15.87 milliliters. Both types of butter provide 717 calories. The protein content is 0.85 grams, and both have an impressive 81.11 grams of fat. This includes saturated fat, with unsalted butter having 50.489 grams and salted butter 51.368 grams. Monounsaturated fats are also present, with 23.43 grams in unsalted and 21.021 grams in salted butter. Polyunsaturated fats are around 3 grams in both types. Carbohydrates are minimal at 0.06 grams. Essential minerals are also found in butter, such as calcium and phosphorus at 24 milligrams each, iron at 0.02 milligrams, magnesium at 2 milligrams, and potassium at 24 milligrams. Salted butter has a higher sodium content at 643 milligrams, compared to just 11 milligrams in unsalted butter. Vitamins such as B12, A, E, and K are also present. Cholesterol is high at 215 milligrams. Despite these nutrients, butter's high saturated fat content means it should be consumed in moderation, not exceeding 10% of daily calories. Overconsumption can lead to obesity, high blood pressure, heart disease, and increased cholesterol, and it is often paired with white flour, contributing to weight gain. Those with dairy allergies should avoid butter to prevent mild to severe reactions. Moderation is key to incorporating butter into a balanced diet. Furthermore, butter is rich in vitamins and contains essential minerals like calcium and magnesium, but it's crucial to remember its high cholesterol and saturated fat content. Consuming butter in large quantities can lead to health issues such as obesity and heart disease. It's best to enjoy butter in moderation, ensuring it fits within a balanced diet. For those with dairy allergies, it's important to avoid butter to prevent adverse reactions, ranging from mild symptoms like hives to severe breathing difficulties. Therefore, while butter can enhance the taste of your meals, it's important to be mindful of portion sizes and overall consumption. When it comes to choosing between butter and margarine, it's important to understand their differences. Butter, made from milk, contains saturated fats, which can contribute to increased cholesterol and heart disease risks. On the other hand, margarine is made from vegetable oils and often contains trans fats, which are also linked to harmful cholesterol levels. Both butter and margarine have their pros and cons. Butter provides flavor and certain nutrients like vitamins A and D. Margarine, particularly the softer types, can be lower in saturated fats and is often fortified with vitamins. Moderation is key when consuming both. It's advisable to diversify your intake to enjoy the benefits of each without exceeding fat limits. Reading nutritional labels is crucial to understand the content of saturated and trans fats, allowing for better dietary choices. It's generally recommended to reduce the intake of saturated and trans fats, replacing them with healthy fats like olive oil and other vegetable oils rich in mono and polyunsaturated fats. This approach supports heart health and overall well-being,